Painless bleeding with intercourse is the prime symptom of blank. Fibroids, as these tend to grow during pregnancy and are and they are benign. If they are internal, they can cause reduced intrauterine space, disrupted placental implantation, and postpartum hemorrhage. What are the 5 basic steps of pelvimetry or bony assessment in order? Number 1, assess the depth of the sacral curve. Number 2, assess the size of the pelvic inlet. Number 3, assess the contour and distance between ischial spines. Number 4, assess the angle or width of the pubic arch. Number 5, assess the outlet dimension or bituberous diameter. What are the key minimum amounts in the prenatal diet for protein, calcium, and fluid? How many calories a day does a pregnant woman need, and how many calories a day does a nursing woman need? Protein needs during pregnancy are 80 grams per day. Calcium needs in pregnancy are 1200 mg per day. Recommended fluid intake is 2 quarts daily. A pregnant woman needs 3,000 calories daily, and a nursing woman needs a whole 1,000 calories additional to that at 4,000 calories daily. What is the possible risk of taking non-toxic high quantities of vitamin C and calcium during the time of delivery? Vitamin C. Newborn withdrawal symptoms include scurvy. Calcium causes neonatal hypocalcemia. What is Paget's disease? This is a rare form of breast cancer occurring from the outside of the breast, nipple, or areola. It first appears as a rash with persistent redness, itching, or burning, and then progresses to oozing or crusting. What are the risks to the baby of a mother who tests positive for Group B streptococcus? Apnea and spinal meningitis. The rate of newborn infection is 1 to 2 per 1,000. Of infected babies, 15 to 20% die. Death rates are higher in premature babies. What are the dangers of and signs of renal disease during pregnancy? Dangers include acute renal failure, and signs of renal failure include protein in urine, hypertension, edema, elevated blood urea before the 20th week of gestation. Why is there controversy over IV antibiotics in labor for Group B strep positive women? One study looked at blood infections of newborns over a 6-year period and found that antibiotics treatment in labor reduced the rates of newborn GBS but increased the rate of other blood infections. Also, some strains of GBS are resistant to antibiotics. When would chorionic villus sampling be contraindicated? Chorionic villus sampling is contraindicated for women who have a history of cervical incompetence, miscarriage, or premature labor. What is the standard of care for women who have active herpes lesions at the onset of labor? It is recommended that a cesarean is performed because neonatal infection can cause central nervous system damage or even death. What is the characteristic sign of yeast infection, also known as monolia? What causes yeast infections in pregnancy? Yeast infection is characterized by white-like curd discharge. Yeast is naturally occurring as a vaginal organism and tends to overgrow in pregnancy because of increased vaginal alkalinity, which is caused by elevated progesterone levels. What may be the cause of itchy palms on the hands and soles of feet in pregnancy? ICP, or intrahepatic cholestasis of pregnancy, in which bile flow is obstructed either mechanically or metabolically. You should consult with a doctor immediately regarding advisability of a liver profile. What are the first and second most prevalent STIs in the United States? Number 1, HPV. Number 2, chlamydia. What is being measured in systolic and diastolic readings of blood pressure? Systolic. This is the pressure in the arteries when blood is actively pumping. Diastolic. This is the pressure in the arteries when the heart is resting. What condition might fatigue combined with dizziness or nausea beyond the first trimester indicate? Anemia. What are some urgent warning signs of preeclampsia? Persistent headaches in combination with visual disturbances or epigastric pain, especially on the right side. What are the risks of chlamydia in pregnancy? This can infect the urinary tract and lead to premature labor. With delivery of a baby, the baby has a 70% chance of infection, which can lead to conjunctivitis or pneumonia and result to maternal chlamydia.